Ondansetron, a widely prescribed medication, is a potent antiemetic that is primarily used to prevent and treat nausea and vomiting caused by chemotherapy, radiation therapy, and surgery. With its exceptional effectiveness, it has become a vital tool in managing these side effects and improving the quality of life for countless patients. Ondansetron works by inhibiting the action of serotonin, a neurotransmitter known to trigger nausea and vomiting. By blocking the receptors in the brain responsible for this response, it effectively suppresses these symptoms. The medication is available in various forms, including tablets, orally disintegrating tablets, and injections, making it convenient and flexible for different patient needs. Common uses of ondansetron. One of the most common uses of ondansetron is in cancer treatment. Chemotherapy and radiation therapy often result in nausea and vomiting as significant side effects. These symptoms can be debilitating and compromise the patient's overall well-being. Ondansetron effectively prevents and treats chemotherapy-induced nausea and vomiting, making it an indispensable medication in oncology. Additionally, it is also commonly used in the prevention and treatment of post-operative nausea and vomiting, providing relief to patients recovering from various surgical procedures. Moreover, ondansetron has shown efficacy in managing nausea and vomiting caused by other conditions as well. Gastroenteritis, commonly known as the stomach flu, can result in severe bouts of nausea and vomiting. Ondansetron can help alleviate these symptoms and prevent dehydration caused by excessive vomiting. Migraines, often accompanied by nausea and vomiting, can also be managed with ondansetron. By targeting the root cause of these symptoms, ondansetron provides relief and improves the patient's overall well-being. Furthermore, ondansetron is sometimes used off-label to alleviate nausea and vomiting associated with other medical conditions, such as vertigo and motion sickness. While not its primary use, it has shown promise in providing relief for these symptoms, allowing patients to regain their balance and comfort. In summary, ondansetron is widely used to manage nausea and vomiting in various clinical scenarios. Its primary uses include combating chemotherapy-induced side effects and post-operative nausea and vomiting. Additionally, it has demonstrated efficacy in managing symptoms caused by gastroenteritis, migraines, vertigo, and motion sickness. Benefits of using ondansetron. The benefits of using ondansetron are numerous, primarily centered around its ability to alleviate nausea and vomiting effectively. By targeting the serotonin receptors in the brain, it blocks the signals that trigger these symptoms, providing relief and improving the patient's quality of life. The benefits of using ondansetron include improved symptom management. Ondansetron is highly effective in preventing and treating nausea and vomiting associated with chemotherapy, radiation therapy, and surgery. By reducing these symptoms, it allows patients to continue their treatment or recover from surgery without the debilitating effects of nausea and vomiting. This leads to improved overall well-being and comfort. Enhanced quality of life. Nausea and vomiting can significantly impact a patient's quality of life. They can lead to loss of appetite, dehydration, fatigue, and reduced ability to perform daily activities. By effectively managing these symptoms, ondansetron allows patients to maintain their nutritional intake, stay hydrated, and engage in their daily routines comfortably. Reduced anxiety and distress. Nausea and vomiting can be distressing and anxiety-inducing for patients. The fear of experiencing these symptoms can cause significant emotional distress. By providing reliable symptom relief, ondansetron helps reduce anxiety and allows patients to approach their treatment or recovery with a greater sense of calm and confidence. Increased treatment adherence. For patients undergoing chemotherapy or radiation therapy, treatment adherence is crucial for successful outcomes. Nausea and vomiting often lead to missed or delayed treatments, which can compromise the effectiveness of the therapy. By effectively managing these symptoms, ondansetron increases treatment adherence, ensuring patients receive the full benefits of their prescribed treatment. In conclusion, the benefits of using ondansetron are clear. It provides effective relief from nausea and vomiting, leading to improved symptom management, enhanced quality of life, reduced anxiety and distress, and increased treatment adherence. Potential side effects of ondansetron. While ondansetron offers significant benefits, like any medication, it is not without potential side effects. It is important to be aware of these side effects and discuss them with your healthcare provider to ensure safe and optimal usage. Common potential side effects of ondansetron include headache. Headaches are a relatively common side effect of ondansetron. They are usually mild and temporary, resolving on their own without intervention. However, if the headaches are severe or persistent, it is important to consult your healthcare provider for further evaluation. Constipation. Ondansetron can cause constipation in some individuals. This side effect can be managed by increasing fluid intake, consuming a high-fiber diet, and staying physically active. In some cases, laxatives may be prescribed to alleviate constipation. Dizziness. Dizziness or lightheadedness may occur as a side effect of ondansetron. It is important to be cautious when getting up from a sitting or lying position to avoid falls or accidents. If dizziness persists or worsens, medical attention should be sought. Fatigue. Some patients may experience fatigue or drowsiness while taking ondansetron. It is important to be mindful of this side effect and avoid activities that require alertness until the effects wear off. If fatigue becomes severe or persistent, it should be discussed with a healthcare provider. Allergic reactions. Although rare, allergic reactions to ondansetron can occur. Signs of an allergic reaction may include hives, itching, rash, swelling of the face, lips, tongue, or throat, difficulty breathing, or tightness in the chest. If any of these symptoms are experienced, immediate medical attention should be sought. It is essential to note that these are not exhaustive lists of side effects. Some individuals may experience different or additional side effects while taking ondansetron. It is important to report any concerning symptoms to a healthcare provider for proper evaluation and guidance. Recommended dosage of ondansetron. The recommended dosage of ondansetron varies depending on the specific indication and the patient's individual characteristics, such as age and weight. It is important to follow the prescribed dosage instructions provided by your healthcare provider. The typical dosage recommendations for ondansetron are as follows. Chemotherapy-induced nausea and vomiting. For the prevention of chemotherapy-induced nausea and vomiting, the recommended adult dosage is usually 8 mg taken orally 1 hour before chemotherapy. Additional doses may be prescribed depending on the duration of the chemotherapy regimen. Pediatric dosages are determined based on the child's weight and are prescribed by the healthcare provider. Radiation-induced nausea and vomiting. The recommended adult dosage for the prevention of radiation-induced nausea and vomiting is usually 8 mg taken orally 1 to 2 hours before radiation therapy. Additional doses may be prescribed depending on the duration of the radiation treatment. Pediatric dosages are determined based on the child's weight and are prescribed by the healthcare provider. Post-operative nausea and vomiting. The recommended adult dosage for the prevention of post-operative nausea and vomiting is usually 16 mg taken orally 1 hour before surgery. Additional doses may be prescribed depending on the duration of the surgery and the patient's individual risk factors. Pediatric dosages are determined based on the child's weight and are prescribed by the healthcare provider. It is important to note that these are general dosage guidelines and may vary depending on the specific circumstances and the healthcare provider's recommendation. It is crucial to follow the instructions provided by the healthcare provider and not exceed the prescribed dosage. Risks associated with ondansetron. While ondansetron is generally considered safe and well tolerated, there are certain risks associated with its use. It is important to be aware of these risks and discuss them with your healthcare provider to make an informed decision regarding its usage. Some of the potential risks associated with ondansetron include cardiac risks. Ondansetron has been associated with a rare but serious cardiac side effect called QT prolongation, which can lead to abnormal heart rhythms. This risk is higher in individuals with pre-existing cardiac conditions, electrolyte imbalances, or those taking other medications that can prolong the QT interval. It is important to discuss any underlying cardiac conditions or medications being taken with your healthcare provider before starting ondansetron. Interactions with other medications. Ondansetron may interact with certain medications, potentially leading to adverse effects or reduced efficacy. It is important to inform your healthcare provider about all the medications, supplements, or herbal products you are taking to ensure there are no potential drug interactions. Pregnancy and breastfeeding. The safety of ondansetron during pregnancy and breastfeeding is still being studied. It is important to discuss the potential risks and benefits with your healthcare provider if you are pregnant or planning to become pregnant, or if you are breastfeeding. Overdose. Taking more than the prescribed dosage of ondansetron can lead to an overdose. Symptoms of an overdose may include severe headache, blurred vision, agitation, rapid heartbeat, and fainting. If an overdose is suspected, immediate medical attention should be sought. It is crucial to discuss these risks with your healthcare provider before starting ondansetron. They can provide personalized guidance based on your medical history, current medications, and individual risk factors. Ondansetron for different medical conditions. While ondansetron is primarily known for its use in cancer treatment and post-operative situations, it has shown efficacy in managing nausea and vomiting caused by other medical conditions as well. Some of the medical conditions for which ondansetron has been used off-label include gastroenteritis. Gastroenteritis, commonly known as the stomach flu, can cause severe nausea and vomiting. Ondansetron can effectively alleviate these symptoms and prevent dehydration caused by excessive vomiting. It is often prescribed in combination with other supportive measures, such as rehydration therapy and dietary modifications. Migraines. Migraines are often accompanied by nausea and vomiting. Ondansetron can be used to manage these symptoms, providing relief and allowing patients to function more comfortably during a migraine attack. It is typically prescribed as part of a comprehensive migraine management plan, which may include other medications and lifestyle modifications. Vertigo. Vertigo, characterized by a spinning sensation and dizziness, can lead to nausea and vomiting. Ondansetron has shown promise in managing these symptoms by targeting the underlying cause of vertigo. It may be prescribed in combination with other medications or therapies specifically tailored to address the vertigo's root cause. Motion sickness. Ondansetron can also be used to manage nausea and vomiting associated with motion sickness. It effectively reduces the symptoms and allows individuals to travel without the discomfort caused by motion-induced nausea and vomiting. It is typically taken before the anticipated motion exposure to provide optimal relief. It is important to note that while ondansetron may be used off-label for these conditions, it should always be prescribed by a healthcare provider who can assess the appropriateness of its usage and provide proper guidance. Alternative medications to ondansetron. While ondansetron is a commonly prescribed medication for nausea and vomiting, there are alternative medications available that may be used in specific situations or if ondansetron is not well tolerated. Some alternative medications to ondansetron include metoclopramide. Metoclopramide is another medication commonly used to manage nausea and vomiting. It works by increasing the movement of the stomach and intestines, which helps reduce nausea and vomiting. It is often prescribed for conditions such as gastroparesis, where the stomach muscles do not function properly. Prochlorperazine. Prochlorperazine is an antipsychotic medication that has antiemetic properties. It is commonly used to manage nausea and vomiting caused by various conditions, including chemotherapy, radiation therapy, and migraines. It works by blocking dopamine receptors in the brain, which helps alleviate these symptoms. Dexamethasone. Dexamethasone is a corticosteroid medication that can be used to prevent chemotherapy-induced nausea and vomiting. It works by reducing inflammation and the release of certain chemicals in the body that can trigger these symptoms. It is often prescribed in combination with other antiemetic medications for optimal effect. Promethazine. Promethazine is an antihistamine medication that has antiemetic properties. It is commonly used to manage nausea and vomiting caused by various conditions, including motion sickness, allergies, and migraines. It works by blocking histamine receptors in the brain, which helps alleviate these symptoms. It is important to discuss alternative medications with your healthcare provider, as their appropriateness will depend on your specific medical condition, underlying health, and potential interactions with other medications you may be taking. Precautions and considerations when using ondansetron. When using ondansetron, it is important to take certain precautions and consider specific factors to ensure its safe and optimal usage. Some precautions and considerations include informing your healthcare provider. It is crucial to inform your healthcare provider about any underlying medical conditions, including cardiac conditions, electrolyte imbalances, liver or kidney disease, or any other health concerns. Additionally, it is important to disclose all medications, supplements, or herbal products you are taking to avoid potential interactions. Pregnancy and breastfeeding. If you are pregnant, planning to become pregnant, or breastfeeding, it is important to discuss the potential risks and benefits of using ondansetron with your healthcare provider. They can provide personalized guidance based on your specific situation. Driving and operating machinery. Ondansetron can cause dizziness or drowsiness in some individuals. It is important to be cautious when driving or operating machinery until you know how the medication affects you. If you experience severe dizziness,